Hi, how are you? Welcome to Live United. I'm Kenrick Thomas, the Director of Marketing and Communications for the United Way of St. Lucie County. Each month, we like to have one of our funded partners come on and talk about their organization and how they impact the community. Today, we have Teresa Bishop from Roundtable of St. Lucie County, the Executive Director. Thanks for coming on.
Oh, thank you for having us.
No problem. Now, before we get started, tell us a little bit about Roundtable of St. Lucie County.
Well, the Roundtable of St. Lucie County, I would say, is the best kept secret of St. Lucie County, and a lot of folks are looking at what we're doing here in the community. We are not just in the community, but around the United States, because we are a nonprofit organization that brings together executive level leaders to sit down and work on system change as it relates to outcomes for youth. As a whole, we don't focus on quick fixes, but we focus on identifying comprehensive, research-based approaches that we know that can impact the lives of youth here in our community.
That's really great. Now, I know there's a lot that goes into this organization. Talk about some of the committees and who contributes to the organization's impact.
Okay, so that's an excellent question. Well, first of all, at the very base, there are some outcomes that we look at addressing. Teen pregnancy, school dropout, substance misuse prevention, violence prevention, and delinquency are just to name a few. We utilize the Communities That Care framework by Dr. Hawkins and Dr. Catalano, looking at what are some of the things that drive youth problem behaviors in communities. And so those are some that we focus on, those main 5 problem behaviors. But we also have expanded the network, the organization, to also look at behavioral health, to look at child and adolescent health, including unintentional injury, infant mortality, and healthy weight. And we also have a child welfare and health network that looks at foster care and working with kids who are vulnerable, and the child welfare system.
You also have steering committees, networks, and also subcommittees who partake in this effort as well.
Absolutely,
yes.
Absolutely. So that's a lot of work that we have in terms of the outcomes. And so how we are organized around these very specific areas. So we have, for example, a substance abuse, now they don't want us to use the word substance abuse because we now know it's a disease. So it's a substance misuse network. And we've been funded by the Office of National Drug Control Policy to launch Drug-Free St. Lucie. So we are working on substance misuse at the community level, impacting access to drugs and alcohol, policies, practices, and norms. That's one of them. We also have another network, which is the Safe Neighborhood Network, that is focusing on violence and delinquency. We've been able to be funded by the Office of Juvenile Justice and Delinquency Prevention to launch the comprehensive gang model here in St. Lucie County. We actually have outreach workers that are in the community that work with young people who are involved with gangs to help them to be successful and to come out of gangs and live a better life. So that's one of them. We also have a behavioral health task force now that we've had this executive order. That's our newest task force, executive order from the governor to address school and community violence. And so we have brought together a number of folks in our community who are experts that are working on behavioral health issues to determine how we can look at our system to see how we can respond to the behavioral health needs of youth and families better. We also have the Child Welfare Network, as I mentioned earlier. And one of the biggest things that they've done is they've worked on a lockout protocol to help young people who parents have basically said, I'm not bringing them back home. So we are trying to make sure that our young people are able to stay in the home. So several agencies got together and said, well, how do we do a better job? So they've developed a lockout protocol. This is to name a few. We also have an Academic Success Network that we're working on some of the academic outcomes that are going on. We have a number of people that are sitting at the table to determine how we can improve reading levels and literacy, and all those things are around youth being successful with academics. We also, so there's many of them, so we also have a youth leadership network that are made up of youth leaders from St. Lucie County. We have a Port St. Lucie leadership, and we also have Fort Pierce leadership. and they're working on, from their perspective, some of the issues that we see that are going on in the community and making recommendations to the roundtable of some of the things that, from their perspective, what needs to be addressed. A couple of other networks that we also have, let's see, we also have, when we mentioned the behavioral health, we also have, I just drew a blank because we have so many of them that are on our networks, but that just gives you an idea. You can always look on our website to look at the other networks that we have in our community. I did mention the health network earlier.
Yes,
and
definitely.
So we are working on a number of issues around health as well.
That's really great.
Oh, I can't forget this.
Yes.
We have a economic sufficiency network, which are the facilitators of and organizers of Bridges Out of Poverty. That is a training curriculum for our community to be able to work with communities that are economically deprived and to be able to look at how our organizations can do a better job of addressing the needs of them. So that's just to name a few of the networks that we're working with.
That's really good. That's a loaded, I can tell at your office you're always busy.
Very.
Yes. Talk about some of your goals and how you want to improve St. Lucie County.
Well, as we talked about mentioning earlier, we have a strategic plan, a 5-year strategic plan that we're working on now, and we've established goals for each of the networks. You know, for example, how do we want to see teen pregnancy reduced in St. Lucie County? How do we want to reduce substance misuse in our community? And there's a myriad of outcomes that we have, and what we do is we use the data, we collect data from St. Lucie County, also state data, to look at where we are in terms of some of these problem behaviors that we identify. And we discuss what are some strategies that we can put in place to change some of the indicators that we have that we could do a better job with teen pregnancy, infant mortality, school academic success, and so on. So there's a number of those. If you're interested, you can always go to our website and pull down our strategic plan, because we'd be here talking forever of the outcomes. But the most important thing is we create space for professionals and grassroots folks to come together to look at these different outcomes from their perspective and identify ways that we can reduce them using research-based practices.
Great. Why did you get involved with this organization?
Well, you know, the interesting thing, how things come full circle. Over 20 years ago, I was actually at the very beginning of the launching of the Roundtable, and I was actually one of the folks that was involved with some of the networks, and I had an opportunity to become a consultant nationally and work on a number of youth development issues, violence, delinquency, substance misuse around the country and abroad. And the door opened up for me to be able to come back home and take some of the expertise that I've learned and be able to bring it to my very own community. That's on a broader scale. At a very granular scale, myself and my brother and my sister both came from environments that no child should come out of. And as we became adults, we struggled with a lot of issues as it relates to all these issues that we're addressing. Most of them, either one or all three of us struggle with them. And I've decided even more recently, I really embraced the need to be a child advocate. And the Roundtable is a perfect place for me to do this. I would be doing this work. I can't tell my funders this. I'd be doing this if I wasn't getting paid for it. I love my job. I love the opportunity to work with all of the wonderful leaders we have in our community that are really serious about changing the trajectory of youth to be a positive trajectory so that they're able to succeed. So this is my life narrative. This is something that I love to do. That's
great. Talk about the partnership that you have with the United Way of St. Lucie County.
Well, the partnership, first of all, we're just really very thankful for Karen Knapp, because she saw the vision for Kids at Hope, and we'll talk a little bit about that later. She has helped to fund Kids at Hope for our organization over the years. She's also an integral part of our Roundtable in terms of our decision-making here in the community.
That's great. Now, how has that partnership helped your organization?
Well, you know, of course, United Way is a funder, and we, you know, a lot of the things we do, you can't do it unless you have funding. But also, you know, when I think about the leadership at United Way, they also weigh in and help us think about some of these collective issues that we need to be collective impact issues that we are looking at. And when I talk about collective impact, how can all of our organizations work together collectively to impact our community and aim in the same direction? So a lot of the expertise that comes from the roundtable, we also have some of your staff that participate on our network, on our networks as well. And we appreciate the leadership for that because our networks are voluntary. So we have a huge steering committee, and the United Way has one of their staff that actually co-chairs our steering committee that helps keep this thing going. Because our staff is small and we can't do everything. So to be able to have that in place to help us steer the work of the roundtable is very helpful for us.
Great. So what is Kids at Hope?
So Kids at Hope is an initiative that was founded by Rick Miller, who lives in Arizona. And it is not a program, it is a belief system. And when we talk about a belief system, not only is it a belief system, it's a belief system that's backed by cultural change as well as strategies in the schools and the community to support the belief system. So what exactly is this belief system? This belief system has, we call, 3 universal truths. One, we believe. And so what we know is that if young people have caring adults that believe in them and believe in that they can be successful, they can be successful. We actually have opportunities. Our roundtable recites the pledge that all kids are capable of success, no exceptions. But not only do we say that via our words, but we also think about, well, how do we make that look in our communities, in our schools? How do we do that? So we believe. The second thing is we connect. We know in order for young people to succeed, they have to connect with caring adults. We call them ACEs. And these ACEs could be parents, they could be the custodian in the school, the bus driver, it could be a number of folks. And how are we greeting them? How are we working with them? How do we see them? Do we see them as kids at hope, or do we see them as kids at risk, which is an entirely different paradigm? And the third thing that we look at is, and third universal truth is that we time travel. We know that if kids can project what their lives are going to look like in the future around family, around home, around hobbies and entertainment, around education, career, community service, and just serving, when they can see their future, we know that they're capable of success. And so that is the whole framework around that. And what we do is we work with communities to not only say this, with our community to not only say this, but how do you incorporate this as the way you do business in your schools, in your after-school programs, and even in the homes, your faith-based organizations. And so that's what Kids at Hope is.
Great. Now, if there's a parent out there who wants their child to get involved with Kids at Hope, how would they do that?
Well,
what's the process
like? Well, Kids at Hope is not a program, again. So what happens is most of our kids that are in schools are part of Kids at Hope. So whether it is in the schools where they are helping these young people to time travel, whether they're putting on activities about careers, or whether they're doing activities around family and future family efforts. Also, if we're at the Boys and Girls Club, which is one of our partners, a number of partners where we're helping our young people to identify who are the ACEs in their lives, also asking folks, are they an ACE? So to become a part of it is, we are if I would say this, we are a Kids at Hope community, and chances are the majority of the kids in our community have been involved in some way or another. Whether they have gone to the Boys and Girls Club, whether they've been at school and have participated in activity, or some type of community event where they're time traveling, or they're working on their ACEs, or they're communicating the pledge, whether they're doing vision boards. So because we're a Kids at Hope community, I would venture to say the majority of our young people in some way are already participating in the Kids at Hope approach here in the county.
Okay, great. Is there a specific age, or is it just anyone who's in school that wants to get involved?
Kids.
Really? That's great.
Kids.
That's really good.
Yeah,
that is
kids.
really good.
Yeah.
Now, what kind of an impact you've seen in St. Lucie County through Kids at Hope?
The biggest impact that we've seen is the whole common language that we're developed around kids. And I mentioned earlier, instead of us saying that kids are at risk, we now speak at these kids are at hope, which is an entirely different paradigm. And so instead of looking at the glass as half empty, we're looking at the glass as half full, or we're looking at the glass as full. And what can we do to top it off? How can we embrace these young people so that they are able to see their success, whatever that success is going to be? So that's one thing. The other thing is that, we also have seen many of our schools and community organizations have embraced the tunnels of hope, which the first week of school after winter break and even around testing, some of your kids might show up to school and there's a bunch of community leaders and grassroots folks, faith-based organizations cheering them on, letting them know you can do it, we believe in you, and we're doing that. So we're seeing Kids of Hope activities or the way people are doing business incorporating the Kids of Hope philosophical framework, whether it is time travel and showing them how to look at their career, build on their career, whether it is looking at where they want to go for school. These are a number of things. So we see this as a way of folks changing the way they look and respond to the needs of and the success of young people in our community.
Do you have a success story where this initiative impacted a child or helped improve the child? And maybe putting you on the spot a little bit.
I would say that we have lots of success stories.
Okay.
And some of them I would say are anecdotal. When you see young people stand up and say, I am a kid at hope.
Yes.
And they say, and they belt this out with compassion, and they believe, and you see that they believe that. For us, that's success. When we see kids that are in schools and there is an environment that has shifted over the years from being a kid that is at risk to understanding that this kid is hopeful and that we can play a major role of building hope, we can do that. So it is kind of putting me on the spot, but not necessarily, because it's a really broad approach to the work that we're doing in terms of talking about individual kids. Because again, it's not a program. It's really a belief system.
Yes, yes. Mm-hmm. And that's just a little bit of what you do, because you also have programs that you offer as well, such as children and adolescent health, Bridges Out of Poverty, Getting Ahead as well. Talk about some of those programs.
So we mentioned some of those earlier.
Yes.
In terms of programs. So Roundtable itself, we don't necessarily engage in specific programs, but what we do is we do have initiatives that we fund. They're comprehensive initiatives, and I mentioned to you the anti-gang strategy that we have. Those staff are staff that work directly for the Roundtable. The Kids at Hope staff actually run the Kids at Hope program out of the Roundtable, and Drug Free St. Lucie is run out of the Roundtable. And so some of the other initiatives that are done by the networks I mentioned earlier are the facilitation of Bridges Out of Poverty, the lockout protocol, even 51210, I hope I'm saying it right, for the health department, 50210, I believe. Clint will get me later on if I don't get the numbers right, but these are initiatives around healthy eating, which I don't work as closely to that because those are the networks that are working with that.
Yes.
I oversee the networks. And see some of the work that they're doing.
Great. Now, you talked about the gang violence initiative. How big of a problem that is in the area?
Well, here recently we've had a rash of shootings. However, I don't want our community to get lost in the sauce regarding that. When we started that, and I mean that not tongue-in-cheek, because when we initiated the comprehensive gang model 14 years ago, we were in the 50s in terms of the most dangerous cities in the United States, and now we're ebbing at 95, getting ready to move out of the top 100. So sometimes we see some rising of gang violence. When we look at the overall trajectory over the last 4 years, our gang violence has gone down significantly. We've seen some other things that are happening with some of the older adults that are part of the violence, but gang violence in itself, we've seen a significant decrease. We've seen over a 59% decrease in gang violence over the last 4 years.
That's
and the
great.
inception of our program.
Also, the Bridges Out of Poverty, is that how big of a problem that is also in this county?
Be specific. What are you asking?
Like pretty much poverty as far as concerning youth or poverty concerning adults that actually live in St. Lucie County.
Well, we have pockets of community. We have pockets of where there are high levels of economic deprivation and poverty in our community.
Okay.
And of course, you all fund some of those initiatives that are throughout the community. And we know that the impact of poverty is really not just poverty, because you can have an impoverished community, but still have a sense of community. When you have extreme economic deprivation, which is different than poverty, extreme economic deprivation means that you are deprived of access to stores. You have food deserts, where you don't have access to a lot of services. Because there are communities around the United States where people live in poverty, but you don't necessarily see violence and a whole lot of other poor indicators.
Yes.
It's about extreme economic deprivation, where people don't have access to the appropriate resources, services, supports, foods, to be able to provide a buffer for them in community. So yes, for a number of families in our community, poverty is a significant issue. That is not something that we necessarily take on, because we can't reduce poverty. I mean, not at the round table. That is not our scope of work. We can possibly work at how do we build bridges for young people who are living in poverty to have an opportunity for success, so that they can be successful, no exceptions.
Yes.
But in terms of moving the poverty indicators, that is not our scope of work. It's too big of an indicator. When you think about poverty and the indicator itself, these are structural issues and systems issues, and you have to have a wide range of folks outside of the round table who are working on, bringing employment into the community, which our community is working very hard at, looking at the infrastructure and a number of other things in relation to that, to address poverty in our community.
So your organization does a lot of work in the community.
We do.
How does it make you feel to go to work every day knowing the kind of impact that you have?
It's empowering, it's encouraging. I get to sit in an environment with, over 32 executives. So the roundtable is not just staff people that come to these meetings, but when you sit in a room with executives for over 20 years, they continue to sit down and meet. And they have their thinking caps on of what can we do to strengthen our community even more? What can we do together to do that? I love living here. And when I was traveling around the United States, I've been in communities where the executives were not sitting together. It's fragmented. You might not have the superintendent of schools at the table, or you might not have law enforcement at the table, or United Way is missing. In our community, every month we meet the first Friday of every month. We have a quorum, and folks come in and they sit down, and either we're doing presentations or we're identifying some very significant issues that we need to address, we need to fund, or what have you. It helps me to be able to get up and go to work every day. I really, really love my job. There are communities I've seen where administrators are crying because they just can't get 3 or 4 people in the same room together to talk at the same time. So we're very blessed in St. Lucie County. And not only are we blessed that we come together, when I look at each and every one of the executives across all of our children serving agencies, our public safety agencies, and even we have a couple of politicians that are sitting on our roundtable as well. These people care. That's big. And you see it, and not only they put their money where their mouth is in a lot of cases, and they're constantly putting resources in place to continue to do that. I can work with that.
That's good.
I can work in that
That's
environment.
Really good. Now, if there's someone that's watching and they want to get involved with your organization, how can they do that?
Well, you can go to our website. You had an opportunity to look at our website.
Yes.
We have our website, which is www.roundtableslc.org, www.roundtableslc.org. I'm sure you probably will put it on the screen eventually.
Yes.
And our number is 772-871-5880. I encourage anyone who is interested to visit our website, because our strategic plan is on the website, our gang assessment is on our website. We also have a newsletter that's on our website every month that announces a lot of the things that our partners are doing in the community. And you will also see the networks that I described where we have meeting times, so that if you have a particular interest, these networks are open to folks to be able to come in and be a part of the networks. If you have some expertise, or and expertise doesn't necessarily mean that you have to have a degree. It could be that you're a person that's living in poverty,
yes,
and you can speak from that perspective of some of the things that are missing in the community, some of the things that you need. There's opportunities for you to participate that way. And we encourage community participation, because that's where you get the real answers, and that's where you get the information you need to make decisions that's going to impact the people right where they live.
Great. Now, just to piggyback a little bit, just in case there's people just tuning in, what is the Roundtable of St. Lucie County?
Oh, we're going to piggyback on that. So you're going to test me again. Okay, so the Roundtable of St. Lucie County, it is in fact a nonprofit organization. It's made up of executive level leaders who work together to achieve system change, whether it is changing policies or practices, or building capacity around trauma-informed care or social emotional learning. I mean, there's a lot that we do, all with the spirit of improving outcomes for youth. And as I mentioned earlier, we don't focus on quick fixes. We look at, what are some evidence-based practices that we can implement in our community that can change the lives of youth and families in our community.
That's really good. Now, you also work closely with the Children's Services Council as well.
Yes. The Children's Services Council is one of our biggest, if not our biggest cheerleader. I'm really appreciative for Sean Boyle. They fund a number of our initiatives, but we also work very closely in the work that they do, because there are outcomes that they like to see for young people as well. So they have embraced our strategic plan as well. To make sure that some of the things that a lot of the things that they're doing are consistent with the needs that we've articulated in the strategic plan. So they are not only our funding partner, but they are certainly our champion in the community, along with United Way.
That's good. Now, your board meetings, you said, is every first Friday
every
of the month.
First Friday,
and it is open
month.
For people to come if they want to sit.
Yeah, we definitely have a gallery. But you want to look at the schedule on the website, because we rotate once a quarter to Fort Pierce at the Housing Authority to work specifically on the comprehensive gang model and all the issues that are going on in the Fort Pierce area. To make it, because it just makes sense for us to do that there, so that some of our folks that work downtown, whether it's the judges or whether it is our prosecutor or our public defender, are able to come to these meetings, so that we can discuss real change around system reform as it relates to young people that are coming in the system that are at risk or involved with gangs.
Thank you so much for coming on. It's really been a pleasure. I learned so much about your organization.
Thank you.
And I look to have you on again.
Oh, okay. That would be great. I would like that.
Yes, definitely.
We just scraped the top of the iceberg.
Thanks for watching.